Hello, I'm Dr. David Johnson, Professor of Medicine and Chief of Gastroenterology at Eastern Virginia Medical School in Norfolk, Virginia. Well, get ready for some more news about PPIs may be bad for your life. The most recent study comes from Manitoba, just published in the Canadian Medical Association Journal, and this received national press, so I want you to be aware of this because patients are going to be asking about this. And the implication for this study is that PPIs, proton pump inhibitors, may be associated with an increased risk for osteoporosis-related fractures or hip fractures. This is the third study that's looked at this now. Again, an observational cohort study involving nearly 16,000 patients. Again, a retrospective analysis from data gleaned from a population-based database. What they allude in this study is that the odds ratios were increased for an osteoporotic hip fracture or any fracture due to osteoporosis by an increased ratio of about 1.9 times only after 7 years of exposure to a PPI. Now, hip fractures were increased after 5 years of exposure to a proton pump inhibitor. Now, the implication is that calcium is impeded as far as absorption if you give somebody an aggressive acid inhibition. Calcium salts are rendered insoluble if there is less acid, and so the implication is giving a potent agent like a proton pump inhibitor would decrease calcium absorption. Now, the argument against this is that none of these agents cause achlorhydria, and in fact, if you really want to do this study well, what you do is do a study in patients that are achlorhydric, pernicious anemia patients. These are codes that patients could clearly be identified, and this could be a nested cohort in this particular study, but the authors did not include that type of data. So until we prove that this is really in the worst case of acid inhibition, it seems nonsensical to start to make challenges on lesser cases of acid inhibition, such as a proton pump inhibitor. Now, another scientific observation that would argue against this correlation with increased risk would be that osteoclast activity is driven by a proton pump. Now, what do you think a proton pump inhibitor would do? It would preclude osteoclast resorption of bone, and in fact, in vitro studies show that just to be the case. In fact, calcium excretion, urinary calcium excretion, is diminished in patients on proton pump inhibitors, and osteoclast activity is inhibited by proton pump inhibitors. So it seems to be contrarian to this whole discussion. Now, let me give you another evidence rule as you start to look at this study particularly. When you start to look at the increased risks and say, is there stratification bias? Well, the answer is yes, there is, because the patient groups showed a significant increased exposure to other drugs that we know correlate with osteoporosis and fractures. Now, the p-values I'm going to list are all 0.001, and look at the contrarian potential biases. The patients had higher values of use of thiazide diuretics, antiestrogens, anti-epileptics such as Dilantin, patients that were receiving SSRIs, the serotonin uptake inhibitors, oral corticosteroids. Now, why would that not be balanced if these were going to be an appropriate reflection of the evidence? So again, this incredible stratification bias raises a lot of evidence questions as you start to look at the data. Now, I'm not going to say this is right or wrong. I'm just going to ask you to create the right rules of evidence in your own mind. Be ready for patient questions. But I always come back to, what if the patients weren't taking these medications? The worst case scenario of these people stopping their medications without consulting their physicians, the patients that are taking it for NSAID prophylaxis or peptic bleed or stricture prophylaxis, again, this could really spin out into a very negative effect on patient care. Beware, be aware, and be forearmed, because the patients are going to come in and ask you questions. This is Dr. David Johnson. Hope I've inspired some interest in this, and I will invite you to correspond with your colleagues and discuss this in the section below. Hit that, correspond with your colleagues, and I look forward to our next interaction. Again, the evidence will hopefully guide us, and we need prospective trials to really validate this. Time will tell, but I'm not worried. Thank you.